first, thank you for all the love we've been getting on the video where we gifted our daughter a car for her 18th birthday. I've also gotten some questions that need answers, so let's get into it. A few of you have asked, what do we do? My husband and I own a primary and urgent care in Pikesville, Maryland, where we provide medical services such as routine preventative medical care. Think your annual wellness visit, blood pressure checks, prescription management. Then we also offer urgent care services. If you have a cut, rash, you need STI testing, we offer pre-employment testing, DOT physicals. We also have wellness services like medical weight management, vitamin boost, IV hydration, and we also offer therapy, individual, couples, and families. So that's pretty much what we do. We are here to care for you, to help you get well, live well, and stay well. My husband and I own a primary and urgent care, and a couple of you have asked some questions I'm happy to answer. But before I do, a couple disclaimers. We live in Baltimore, so our practice is governed by Maryland laws, rules, and regulations. If you live in West Bumblefuck, you may need to check the rules and regulations for West Bumblefuck. The other disclaimer is what I'm going to talk about is a way. It's not the only way. It is the way we opened our practice. It is the way we run our practice. If you would never, you don't have to. So let's get into it. I see a lot of questions around what our background is, and I'm going to get into that, but I want you to think about even a medical clinic, a private practice as a business, meaning there are hairstylists who own salons. There are also salon owners who are not hairstylists, who do not have a cosmetology license. Their background is business. They have the money, they have the ideas, they have the connections. So they own a business where they are not the doer. I feel like a lot of people want to know, are we a practitioner? Because there's this thought process that you have to be a practitioner to own a practice. And while there are a lot of people who run their clinics like that, that is not the only way to run your clinic. So you do not have to be a clinician to own a clinic. I am not a clinician. My degree is in marketing. Prior to us opening a clinic, I was in a leadership role at a large investment management firm. So I bring the business side, and I feel like a lot of service-based companies missing the business side. Like they do what they do really well, but they don't have that business side, and that's where some of the processes are lacking, the customer service is lacking, the marketing is lacking. So that is what I bring to the table. Like my background is in Lean Six Sigma and BPI methodologies and how can we scale things. On the other hand, my husband is a nurse. I'll talk more about his background because I feel like there's going to be a lot of questions around that. What I will say is he worked in the ER for about 18 years. He's worked in urgent cares. He's worked bedside. Like his experience in medicine is really deep. And when you marry that with the business side, that's why our practice has legs and is primed to be successful. I still feel like we're in our infancy. We are not where we want to be yet, but we are definitely not where we started. From a staffing standpoint, all of our providers are nurse practitioners, and so far, all of our nurse practitioners are Black females. We do not need a physician to provide the type of care that we provide, and that's also why we do not hire PAs. We only hire nurse practitioners as providers because a PA has to ride on the physician's license, and from our standpoint, it's not profitable and it's not necessary. My husband and I own a primary and urgent care. A couple of you have asked some questions. I'm happy to answer. Let's get into it. This is such a good question, and I'm going to try to answer it in a way that I address some of the other questions that you've been asking as well. One of our challenges was figuring out what services we were going to offer. Oftentimes, you will look at your competitors and they will be the benchmark for how you operate your business, and that is not always a smart move for you, especially starting out. So a lot of urgent cares have x-ray machines, and that may be profitable for them. We had to take a step back and figure out, is this going to be profitable for us? We would need an x-ray tech to actually work the machine, and thinking about the market we were in and the fact that advanced radiology is right around the corner, would that make sense for us to invest in that equipment and then invest in that personnel, were we going to get our return on investment? For us, the answer was no. So instead, we created a partnership with Advanced Radiology where someone comes in, we can stabilize them and send them right around the corner to Advanced Radiology to get their imaging done. And our EHR is connected, so we get the imaging like that. But on the flip side, a lot of doctors' offices do not draw their own labs in-house. They will send a requisition, and before you come in for your annual visit, you will have to go to Quest or LabCorp to get your blood work done. Not us, baby. You come to us and we are a one-stop shop. So while I know a lot of people have offered phlebotomy services, and I truly appreciate your desire to partner with us, we actually have practitioners that draw blood in-house, and we partner with Quest. So you come in, we need some lab work done, we're going to draw your blood, and then we're going to send it out to Quest. And again, we are integrated with them, so the results upload directly to our patient portal and we can see them like that. So that's a tip that I have for any business owner. What is going to differentiate your experience? For us, it was, we want to be a one-stop shop for our patients as much as possible. We want to make it easy and convenient for them to come to us and get everything that they really need in-house, and for us to be the one coordinating their care. And if you look at your competitors, and a lot of them aren't doing that, that can be the thing that sets you apart and will be the reason why they prefer to come to you rather than going to somebody else. Just a little tip. For urgent care visits, we accept most insurances. I mean, obviously no MedStar and Kaiser because they want you to go to them. For primary care patients, and I got a list right here because I want to make sure I don't miss nobody. We accept Aetna, CareFirst, Blue Cross Blue Shield, Cigna, Humana, Aetna Better Health, Medicare, Medicaid, and mail-in physicians care. New patients 12 years and up. We also have an affordable self-pay fee schedule because we know everybody doesn't have insurance, so everybody doesn't want to use their insurance for different things. We also accept flex spending. We also accept care credit as well. And to the point that was raised earlier about insurance being a challenge, it is a challenge. It is a challenge. Figuring out what insurance companies are going to pay. Well, let me say this. Not all insurance is created equal. It should be, but it's not. There are some insurance carriers that are very easy to work with, that really do not play about their subscribers, and then there are some that we have to fight them tooth and nail to get paid. They try to deny a lot of claims. So that's why I would suggest anybody opening up any type of medical practice, having things that do not have to go through insurance may actually help to keep you afloat, because insurance, once they pay, it could be 45, 60 days after the date of service. So you done rendered the service, and for 2-3 months you're trying to get paid for it. And that's probably why certain providers don't accept certain insurances. I never understood it. I used to think like, why wouldn't you accept XYZ insurance? That's why we don't accept certain insurances. And I'm not gonna call anybody out, but there are certain insurance companies that make it really hard. And the litmus test for us was during COVID. During COVID, things should have been so relaxed. It was a pandemic, and getting people tested and getting people treated should have been a priority, and it was for some insurance companies. If you were fighting us during COVID, you were not somebody who I wanted to partner with when we were no longer in a pandemic. And for that reason, there are certain insurance companies we will not get credentialed with, we will not accept. And it's sad because it shouldn't be like that, but unfortunately it is.